Hey everyone, Evan and Irma here from Inviza Health with Robert and Daska of Inviza Health. Robert, how are you?
Hey,
Good,
Robert.
very good. Hi, Irma. How you doing?
Great to
Hey,
have you
Evan.
here. We've known each other on social media for a couple years, and you've been on a mission at Inviza Health
Yes, we
to
have.
save lives and better humanity. And so that's why we're so excited to have you here. Maybe introduce yourself and a little bit about Inviza Health and your mission around wearable technology.
Okay, I tend to be too wordy, but I'll try to keep it to a minimum. Um, so my name is Robert Indoska. I have a PhD in, technically it's in material science. It's a multidisciplinary degree, so there were no courses of its own. I was funded in the physics department and the electrical engineering department. I took half physics courses, half electrical engineering courses. I was very interested in materials. But I was also interested in MEMS devices, so micro electromechanical systems, little micro things that move around due to electrical stimuli, typically, or they move around and they create electrical stimuli, which is what I'm doing with Inviza. We have smart insoles that are self-charged, or the battery is self-charged from walking. We're making these smart insoles very accurately. The insoles are comfortable. They're orthotic. They actually prevent diabetic foot ulcers. A lot of patents on this kind of more wide open space because people are focused on watches, and we're focused on this new medium for wearables, an insole in your shoe. Again, self-charging from walking, which is really important for hospital at home, our first market. Um, and this is our beachhead market, and we want to use our insoles for remote patient monitoring along with our app and cloud platform and physician cloud dashboard. And so the more you walk, the healthier you get. And there's also an added convenience. You don't have to recharge the battery that often.
That is phenomenal technology. So tell us, how did this idea come together? You have quite a long and storied experience, not just in technology, but in our healthcare system as a patient. Went through some health challenges yourself. That might have been the stimulus for this project.
Uh, in part, it was my own health issues were a stimulus to this project for sure. And I started the company in 2018 the first time. Um, and I got offered a job in Colorado. I'm from the Boston area, and I grew up in at sea level, relatively speaking, 150 feet relative to 5,000 feet above sea level in Colorado. I moved out to Colorado, and when you're at that elevation, your heart has to pump harder to get more red blood cells around with oxygen. And we all know oxygen is very important to the human body, not only for breathing, but we also knew that measuring your blood oxygen was an important factor during COVID. But I ended up because of my actually an infant disease that I got was called rheumatic fever. Rheumatic fever is a virus that attacks your heart valves in your heart and damages them. I didn't know I had it. I knew I had that, but I didn't know I had a problem with my heart until I was older. I won't say exactly how old I was back in 2019. So, but I was older and went through my life without the knowledge that I had a problem, other than I was tired a lot. So probably still had a problem my whole life, but it was not until 2019 where I blew up like a balloon. My heart failed, basically. My left ventricular got large because my aortic valve wouldn't close at all. It's called severe aortic regurgitation. So basically, the blood gets pushed out of your heart, and because the valve doesn't close, it rushes back in, goes back and forth, and never goes anywhere. So you don't get any oxygen around your body. So my left ventricular trying to pump harder and harder and harder, so it got large. It was having a big workout, and your heart, which I had no idea. I'm a physicist by training, electrical engineer. I'm not health professional. I have a medical advisory board for that. Um, the heart controls your water level in your body. I thought my kidneys did that, but it's really your heart that controls the water. Your kidneys control the electrolytes in your body. And so my heart stopped controlling the water level, and I blew up like a balloon. I put on about 50 pounds worth of water weight. So weight's a good indicator, and you look literally like a walking water balloon. You can see the picture on the website under our emission down the bottom. So yeah, if you go just scroll down to the when you see this big guy in China. So the very funny picture here. These onlookers from China, that's 6'5" person with quite a bit of water weight on. I mean, I look quite a bit different now than I did back then. People didn't recognize me at the conference I was in Shenzhen, where I was a keynote speaker. And so ultimately what happened is 2 days before my birthday on April 7th in 2019, my cardiologist, after having my heart, an echocardiogram of my heart, told me I had 2 months to live without having my aortic valve replaced. And you can see the picture. That was, I can't remember if that was pre or post, but giving the thumbs up. I think it was post giving my surgery. And then the next picture that comes across is that you can see the valve inside. They actually had to cut my heart open, cut my old valve out, and put a new valve in. Pretty
Wow.
extensive. So, I do micro electromechanical systems. I'm a macro, electromechanical system now. I'm a cyborg in part. So, ultimately, I almost died, and fortunately, I had my heart fixed, and went back to work. And I was physically better after 4 months of recovering, but I mentally was not prepared to go back to work, to be honest. So ultimately I collapsed at work, and the company I worked for, unfortunately, they eliminated my job position. But I restarted Inviza. Inviza is short for invisible, and the idea is to have the wearables be invisible on your body. So part of the reason we went with the insole is because it's in your shoe, so people can't see it. But honestly, I don't want to have to charge up my shoes or my insoles every day. I already have to charge my phone. That I have to charge my computer, that type of thing. I used to wear an Apple Watch until I realized how inaccurate it is. And it's not medical grade, let's say. And I wanted to go after accuracy, but I don't want to have to charge up these things. So it would, just imagine putting on your pants and that you have to charge them up. Well, that would literally be a pain in the what. So that wouldn't be good. So we went. I did a bunch of interviews with people, customer interviews. Originally, we're going after the consumer market. Now we're doing this B2B, hospital at home play into the market. And we started focusing on accuracy because people, when I did these interviews, said we want accurate data. These athletes said we want accurate data. We don't want more data. We just want accurate data. And the second thing people said is we want GPS in our shoes because we want to be able to find our loved ones, people with Alzheimer's disease and so forth. And so if you have LTE cellular in your shoes, which we do, and as an option, that comes along with a GPS chip. If your wife or husband who has Alzheimer's goes off and wanders, as they call it, and gets lost, we could find them. So these insoles do a lot of things. And most importantly, especially for this market where you go home after cardiac care, after cardiac acute care in the hospital, you're supposed to walk. You're supposed to walk 5 times a week, 30 minutes each time, 150 minutes a week. How does the doctor know you're really doing that? You can say you're doing it, but with these insoles, they'll know if you're doing it, number one, and they'll be able to monitor you for all your vital signs, in a highly accurate, precise way. So medical grade. And we measure, we have a pulse ox that goes on your finger that's FDA approved. If it says 96%, it's 96% from your foot. If it says 72%, it's 72% on your foot. So we measure oxygen, we measure heart rate, we measure body temperature, all very, very accurately. And that was the goal. And we also have motion sensors in the shoes, so we know whether or not you're moving. So if a person is supposed to stay in bed, they shouldn't be getting out of bed. We'll know if the person's moving. We'll know if a person in your insole, in an insole, so here's one of our insoles here. So I have it so you can open it up.
It looks pretty normal, like a normal insole.
It's a very normal insole. And actually, this is our design A. Our design B will be a little bit thinner. Mm-hmm. And inside, this is just got mocked up. It's got these compartments, so you can put the battery and the electronics inside and all the sensors. And they're comfortable. Unlike a lot of orthotics you buy, they tend to be uncomfortable. These are comfortable. I've been told that by many people. And we don't have a size that fits me. I take a size 15 right now. So when we go to the design B, that will be our beta platform that will have multiple different sizes, from size 4C for children all the way up to size 15 for men.
Wow. And
the good news is, even children, they get lost or snatched, by somebody. We'll have GPS in there too for them. So that, so again, there's a lot of things we can do with this. But you got to focus. With a startup company, you have to focus. And so we're focused on this beachhead market called hospital at home. People get discharged from the hospital from acute care for heart attack, heart failure, pneumonia, COPD, hip and knee surgery, those types of things, which hospitals then get fined by the Centers for Medicare and Medicaid Services, CMS. They get fined if the patients get readmitted within 30 days, up to 3% of the bill. So it's a pretty big deal. Somewhere between $350 to $550 million a year gets fined to 40 to 49% of the U.S. hospitals. So this is a cost that goes to the hospitals, and what are they going to do? They're going to transfer it right to the patients. And so this is reduce the cost of healthcare, free up beds, because obviously we had a problem during COVID. So if you can be monitored at home, and this is a big thing in the United States right now, hospital at home, and if we can monitor people accurately at home, and that's great because it's been shown that patients' readmittance goes down using remote patient monitoring from like 19% or higher down to 4%. So it's been proven. But if a patient isn't compliant wearing or not wearing, but using the different, they get a box and they have 4 or 5 different remote patient monitoring things in there, measure blood pressure, measure oxygen, measure heart rate, measure body temperature. They have to measure those things themselves, and sometimes they're Bluetooth enabled and they connect up to your phone or whatever. But sometimes they're not. You have to enter the data yourself. Well, compliance is or should I say, non-compliance is up to 49%. So if you're not using the stuff, it's not going to help. But if you use the stuff, it's going to help. So you slip your insoles into your shoes or your slippers at home. Because I wear Crocs at home because they're extremely comfortable. They're like my slippers. I can put them in my Crocs, and so I can wear them. I can wear them whatever I want to, and be round the clock, be monitored by my physician, or nurse practitioners, or maybe an AI is in the cloud that's monitoring and alerts the physician if there's a problem.
So Robert, you're doing such a great job. We don't even have to ask you any leading questions because you're basically taking us through all the
Yes.
components of the technology and how this is used and
Yes.
deployed. So, but we do want to dive a little bit deeper, specifically into maybe exactly how all this amazing data you're collecting, how does that get to your physician or the nurse? So what is the mechanism? How do they see the data? Are you providing them some kind of analysis, an analytic summary, or they see all the raw sensor data and then they have to make sense of all of it?
Yeah. So um, we are still, I mean, to be honest, we have the installs work very well. The app works well. We have it connected up to the cloud. The cloud is getting built out right now, but so we have a lot of things going. We plan to do in the cloud,
Mm-hmm.
but there's two ways that the data goes from the insole to the cloud. First and foremost is you got a hub, your smartphone or your tablet. So people, especially older people, they love my parents love to use their iPads. They don't want to use a computer anymore, laptop. They like to use their tablets, or even my dad has a smartphone now, an Android, and so we'll have an iOS and an Android app. We only have an Android app right now. We're building that out with a partner company that we have. But it's used as a hub. Why do we want that? Well, if you go into a hospital, a lot of times you don't have cell phone coverage. A lot of times, some hospitals do because they have repeaters and stuff inside, but a lot of times they don't. So we wanted to be able to cover you when you're in the hospital, so people already know how to connect up their phones to Wi-Fi.
Mm-hmm.
So when you're in the hospital, you get Wi-Fi, and then you can do whatever you need to do. And your phone collects all the data through Bluetooth connection to your insoles, and then transmits it through the Wi-Fi to the cloud. So that's way number one. Now, way number two is you walk outside. As soon as you have cell phone coverage, now your phone is now connected to the cellular. And so your shoes are still connected to Bluetooth, connected on your phone, and connect to cellular. But what happens if you forgot your phone at home, or you left it in the car? So two things happen. One, your insoles connect up directly. It's optional to have LTE cellular with GPS in your shoes. And so if a person doesn't bring their phone, so a person with Alzheimer's, they're gonna forget. They forget to bring their phone with them. Probably, they probably don't even make phone calls. Unfortunately, but Alzheimer's patients tend not to forget their shoes. They put them on. You learn at a very young age to put your shoes on when you go outside and walk. So people wear this. My mother's best friend, who's from I can't remember the town, but right near the Blue Hills, Canton. She's from Canton. Very attractive woman. She was a very nice lady. She was a physical education teacher in school, very well liked. Unfortunately, she's now my mother's age, around 79, and she's got really, really bad Alzheimer's. The first time she ever got she wandered and got lost, she was 8 miles away from her house. 8 miles when they found her. Okay. Well, right now she's got it so bad she barely can walk. She takes really small steps, so that's not going to be a problem now. But early on, it was a real big problem, and so having LTE cellular in the insoles is extremely important, and with a GPS, so you can find your loved ones, and also children as well. And then they're self-powered. So the more she walks 8 miles, that's a lot of steps. Eight times two, that's like almost 20,000 steps. So that's a lot of steps that she took that day, and it will keep the battery charged. And so that's the second method. And then what happens if you don't have cell phone coverage? Well, the insoles will store the data in the insoles for up to a week. And so all that data, as soon as you have Bluetooth or LTE, it just downloads the data. It only it's only about 16 megabytes of data. And that's like 4 to 8 pictures. worth of data. So it like as soon as it connects up, it's like boom. It's like 2 seconds. All that data just went into just went to the cloud. It's pretty amazing. It's pretty amazing.
Amazing indeed. You talked about alternatives that are available for wearable tech. This obviously has so many advantages over, watches and rings and necklaces, things you might wear. Talk about that. Talk about how you're going to market at scale and how you think the insole is the future of wearable technology.
Well, first wearables need to be convenient. They need to be easy to use, so that my parents can use them. And the older you get, the more you don't want to. You tend not to want to learn anymore. You're kind of tired, and so my mother's very very astute, and she does a very very good job with the computers. And my dad, on the other hand, just doesn't want to learn that stuff. So, a watch is convenient, but it might not, might not be something you want to. I mean, a lot of people don't want to wear watches. I don't like to wear rings or watches, and if I do wear a watch, I tend to wear it loose.
Mm-hmm.
They might clash with the clothes you're wearing. You might have a purple band, and that's the only band you have, and you have wearing a green dress, it just kind of doesn't go along with it. So having invisible technology going in your shoes, that's important. Now, we're not going to put these in high heels, of course, but we do have ideas on how to make that work too. But so it's mostly going to it's going to be whether you're wearing your sneakers or trainers. I'm not sure who's listening here, and or your shoes or whatever you're wearing. You can switch the insoles from shoe to shoe to shoe, or you can buy a couple pair. These aren't going to be expensive. Our baseline product for hospital at home is going to be, I think it's $260 or $259.99, and it will be covered by Medicare. So that's extremely important for people who are on retirement that can't really afford these types of products. That Medicare will pick up 80% of that tab.
That's amazing. So what is your go-to-market? I mean, obviously, it's a technology that goes in your shoe, but what's the process of getting it into patients' foots, given our overly complicated healthcare system and supply chain and all that kind of thing?
Well, that's our go-to-market strategy. We thought about assisted living facilities and nursing homes. That really, we have a really good, our chief product officer who's in Seattle, Washington, by the way. He used to work for Best Buy Health as a senior director of health marketing and strategy. He said assisted living facilities and nursing homes, they struggle already with costs. So that wasn't the market to go after. And the market we're going after is this hospital at home market. So, there's nursing companies that go to homes, and they can actually save money because they don't have to go to the home, and they still go to the home and talk to the patients, see how things are going, but they don't actually have to go home and make all those vital sign measurements. So they can do more homes. They can fit in more patients during the day, that type of thing. So we want to talk to these nursing at home companies. We want to talk to hospitals, people who are, the directors of cardiology or heads of cardiology at hospitals, the CFO of the hospital. The CFO will be, they're looking to save money, so they don't want to have to pay fines for patients being readmitted. So those are the people that we'd like to talk to.
Now, I'm particularly interested in disease prevention and early diagnostics. So I can see a huge potential for Inviza to identify health issues early and alerting physicians or patients themselves of some kind of impending issue. Could you address that? Is that one of your focus areas?
Absolutely. So, so like I said, I had congestive heart failure. So several things that happened. The early symptoms were, number one, my heart rate increased. My heart rate's usually, low 70s, and I noticed on my Apple Watch it had jumped up into the 80s. But I didn't pay attention to it. Typical guy.
Right.
And I really wasn't. I don't think my Apple Watch at the time had oxygen detection, blood oxygen detection on that. So I wasn't looking at that. And I mean, who before COVID, ever looked at their oxygen? Unless you went to the hospital. No one ever did. And it was. People didn't even know what a pulse oximeter was.
Exactly.
And,
yeah.
And now everybody knows, and everybody checks their oxygen. It's an important parameter, health parameter. So, so my heart rate went up. Let's assume my oxygen went down because my lungs are filling up with liquid. So those are two indicators. The third thing, it was my body weight went up. Now, what we can do, and we have pending patents on this, although it's not in the insoles right now, is measure body weight. We're not going to tell you what your body weight is. We're not going to say, hey, your body weight is 150 pounds or 210 pounds or something like that. Especially women. Every time I tell people about this, women say, I don't want to know my weight. Except for my wife. She's very a fit person. She wants to know about her weight. And my wife is the chief wellness officer of the company.
Wonderful.
By the way, she's
a nurse by background. Is that correct?
She's actually a respiratory therapist. She has her master's degree in pediatric respiratory and pulmonary therapy, and she walks 20 to 26,000 steps a day. So, I mean, for healthcare workers, this would be a really great thing.
Wow.
To monitor their health, because who's going around bed to bed to bed, carrying the diseases around and getting people sick? It's usually the hospital workers, not the patients. So, but we want to keep those people healthy. We want to keep flight attendants healthy. They're handing out drinks. Those drinks might have something on them. I want to make sure they're healthy. So the insoles could, once we have body weight in there, which will be in a couple of years, we're not working on that right now. We did at the beginning, and it turned out it's a very, very hard measurement to make in your shoes. But we're gonna crack that nut, and because it's very important health parameter. Most people we talk to in this profession, they say, wow, that would be amazing. If you can measure body weight, that's the first thing you should work on. And we just wanted to go after the most, easily managed from an engineering point of view to get into the insoles so we can get this product to market as fast as possible. Not invent something new. So everything in the insoles is completely off the shelf from other companies, 100%. So we're inside, it's just a system. Even the energy harvesters, they're being used in a special way that we patented. So these energy harvesters are piezoelectric devices that we can buy from, we're buying from a company here in Massachusetts called Piezo Systems, and they're owned by Midday Corporation, which is also a Massachusetts-based company. And Piezo Systems is right across from the MIT Museum in Cambridge, and I've been working with them for years on piezoelectric materials. What's piezoelectric mean? The word piezo means to squeeze in Greek. And so you squeeze this material and it generates electricity. It's really kind of amazing. So we have these piezoelectric crystals in your shoes, and you step on them and they generate electricity. And they just fill up the tank, the battery, a little bit at a time. So there's also a wireless coil inside. So just like your phone, you put it on a wireless charging pad. We can put our insoles on a wireless charging pad and charge them up. but you don't want to have to do that often. And so we charge them up every day by walking, every single day. So the more you walk, the more you get. Right now, we're getting about, if you walk 1,000 steps a day, you get 1 extra day without charging. There's a battery inside, lasts for 40 days. So you get 40 days plus 1 day for 1,000 steps. And for 5,000 steps, which anything under 5,000 steps is considered sedentary. And the average in America is 4,636 steps. So Americans are sedentary. And so we want to promote walking, part for health, but we also want to promote it so that people don't have to recharge the battery that much anymore. And so it's a win-win situation there. Ultimately, going back to your question, we walk, we measure your vital signs. And so you see your heart rate's up on average every day. So we tracked where we were. I see my history of my data, all my data, we see my heart rate. And then one day it goes up and it stays up for a while, up at a new level. So that change is significant. My oxygen level dropped. I see that change and it's significant. It might even continue dropping, afterwards. Might, not stay constant. It might, get drop and then slowly decline, that type of thing. And so those trends, and then body weight, once we can measure body weight, I went up a significant amount of weight. 50 pounds of water. So if your body weight is going up just a little bit every day, a tenth of a pound, a quarter of a pound every day, it's not that big a deal. That's just because you're probably eating too much. But if it goes up 2 to 3 pounds a day, that's probably pulmonary edema. So what I did the other day, because everybody's all into this chat GDP, artificial intelligence, I typed into chat GDP 4. Here's my symptoms. I typed in my heart rate went up, by this much. My oxygen went down, and my body weight went up. What's the possibility? It came back and it said pulmonary embolism, or congestive heart failure, or this one other thing. Literally in seconds, it knew what 3 possibilities were. And so
Amazing.
we, in the cloud, we want to use, these AI, these large language models, which there's APIs, automated programmable interfaces, APIs, in the cloud, to connect up with Chat GDP 4 or 5 or whatever there is in the future, to help predict what's happening to me right now, because we track that data. Everything's within a certain. Everybody has their own data too.
Mm-hmm.
We always say body temperature ranges from for normal range is 97.5 to 100.5. That's the normal range. 98.6 is the normal. Okay. Well, it's not normal for everybody. So some people are colder, like my mother, because my mother has lupus, and some people are warmer. So everybody has their own. So we can track your data based upon your data and look at it from a statistical point of view and say, okay, now for the last 2 years, you've been, 96 degrees Fahrenheit, plus or minus 0.3 for the last 2 years. But now, so the highest you've ever been is 96.3. Okay.
You create and then give it in
and then
baseline, and from there you can.
Yeah. And then all of a sudden it jumps up to 97. Oh, but you have a statistically different data point there, and so something's happening. So now we look at all that data the same way, and we plug all that data into an AI engine, and it comes back with possibilities, and then it alerts the doctor, saves time for the doctor, and helps you before you know you're sick.
Amazing. So how soon are you going to get this into patients' feet, onto their feet?
So right now,
and into providers?
Yeah, so we've just announced on April 3rd, we announced our beta products. They're not technically beta until you go through beta testing. So they're, we'll call pre-beta. They're our alpha level product, that is ready for beta testing. And so we're looking for customers, and we're talking to a few right now about using this. One of which is the company is called Virtus. It's from Kansas, and the former governor of Kansas, his name was Dr. Jeffrey Collier. He just so happens to be on our board of directors. So the governor of Kansas, who's a surgeon, has his own company called Virtus that's doing hospital at home to monitor older patients, who I met through LinkedIn, and super, super amazingly nice person, down to earth, very easy to talk to, and really cares about people the way we do. We want to help. He wants to help people. We want to help people. Now, there's no question, startup companies, they want to make money. We want to make money too, and look what Elon Musk has done with he's made money from previous startups, and he's parlayed that into new other companies, like SpaceX and, all those different companies he's working on right now, and Tesla, and really changing the world, and that's what, we hope to do too. We want to parlay the money that we can make to, we help people, we make some money, parlay that into either back into the company or into future companies to help more people.
Well, that's so simpatico with our message at Inviza Health. We make money, but we also love educating and informing the marketplace of new and exciting developments in health tech, like what you're doing. And we have to grab coffee or beers here in the Boston area soon. And we look forward to your progress and updates, and hopefully there's some partners and customers and influential folks listening who can help with your mission.
Yeah, so we're looking for beta partners to do beta testing. We're giving good pricing for the beta or alpha level insoles for beta testing. Very good pricing, not full price, so that's excellent for everybody going around. And then once we're putting in for FDA approval. It's just for 510K FDA approval this year. And once we get clearance, because we're not causing any harm to anybody with our insoles, we should get clearance pretty quickly, probably about 6 months is what we've been told. And then we go to, then once they're approved and we're there in the hospitals or the nursing at-home nursing companies buying the insoles, start buying them. They get reimbursed from Medicare, because the Medicare patients are typically the ones that are going to be using this, or health insurance, because this will be a durable medical equipment, DME, will get reimbursed. And I will also mention, and I can say this because the SEC allows it for startup companies now, because we filed a Form D. We are raising money. So we're raising money of a seed round. So we can advertise and tell people we're raising a seed round. We're looking to raise $3 million. And if you're interested and you're an accredited investor, and you can look up what an accredited investor is on the SEC website, please contact us, and we'd love to engage with you, both for your help with on the funding situation, but also to look for your guidance, especially if you have a background in health.
Oh, so great. Well, thanks again, Robert, for taking the time to share your vision and mission. And we're so excited to see this roll out, and see you help people. That's what it's all about. So thanks so much. Any parting thoughts here, Matt?
That's the goal. That's the mission. That is the mission.
No, this is this is a fantastic undertaking. We talk a lot about wearables, and the focus is on wrist, devices on our wrists. I haven't seen much about other form factors, and with your capabilities, both to manage chronic diseases, which we're already struggling, the whole healthcare system already struggling under the weight of a huge number of patients with chronic diseases, and the predictive possibilities of this. COVID, we're supposedly out of COVID now, but there's going to be more new viruses and future pandemics. So I'm excited about both the chronic disease management and the predictive analytics, kind of health, keeping people healthy potentials of this.
Yes, we have to start somewhere and do the hospital at home market, and then broaden our market base from there.
Well, reminds me I need to get my steps. It's a beautiful day here in Boston, so I need to get my 8,000, 10,000 in, and I'll be doing
Good.
that. I'm sure you will too, Robert. Okay, thanks
Absolutely.
everyone for watching.
Thank you very much.
And look
We're
forward
going
to
to use my
questions.
Peloton.
Okay. All right, everyone. Bye bye now.
Thank you very much. Thank you, Evan. Thank you very much for having me.